All right. Thank you very much for your time. Today we're looking at managing quality in health and social care. And the basic aim that we want to achieve is to try and look at how we'll be able to improve quality in health and social care. I will first try to identify who those stakeholders are and how we'll be able to provide better quality of care. Unlike manufacturing, if we say improving quality, the quality is going to be given to who? In fact, stakeholders, the key one being service users, happens to be the main stakeholders that we are trying to improve quality of services that we deliver to them. And our discussion today is going to all center on quality in the health and social care sector. Some of the arguments may apply to manufacturing, retail. Since this module is centered on health and social care, we'll try as much as possible to look at how quality can be improved in the health and social care sector. So first, we need to understand the concept of stakeholders. Within the health and social care sector, the main stakeholders that we can think of are service users. And when I say service users, we're talking about patients who use the health services. It could be in the GP surgery, or it could be in the hospital. In the same way, if you look at the care home as an example, then the service users in the residential care home are the residents who live in the care home, are the main service users. All these groups are vulnerable groups who, in terms of old age or ill health, need support and help. So these people need to be provided with the best quality of care as possible. So the first stakeholders that we can think about is the service users. And when I say service users in this case, I'm thinking about patients who go to the hospital. They are the service users. But they are not the only stakeholders involved. We also talk about the staff at the hospital as service holders. We also have families of patients are also stakeholders. And then we have professionals, probably clinicians, who are actually providing the care, are also stakeholders. So if we talk about stakeholders in the healthcare sector, then the first one are the consumers or buyers or service users who are patients. They are at the receiving end of the services. So most of our discussion will center on how best we'll be able to provide best services for patients, either in the care home, in the GP surgery, in the hospice, or in the hospitals. These are all stakeholders. Right. Let's look at our next slide. How do we meet service user needs? How do we meet their need? And how do we try and provide quality services to them? Number one, in order to meet their needs and provide them the best service, we need to recognize the service users as individuals let's bring in the concept of person-centered care. We need to see the service users, the vulnerable people in the care home, or the vulnerable people in the hospital or in the hospice who have come there to receive the services. If we are to provide them the quality of care, we need to recognize them as individuals. Once we're able to do that, we'll be able to provide person-centered care, care that actually suits their needs, and that is what brings about quality. The second thing that we need to do to meet their needs is recognizing and actively promoting respect for diversity, difference, and adopting inclusive practice. Right? Promoting respect for diversity, difference, and adopting inclusive practice. That is one of the ways that we can promote quality service for service users. Unlike the manufacturing that we try to come out with a nice range of cars in terms of the innovation and the style, in the health and social care sector, we need to recognize and promote respect for dignity, difference, and adopting inclusive practice, where their views are also heard and utilized. Again, in order to meet service user need, we have to take a holistic approach to meeting their needs and safeguarding. Right, so we should be able to meet their physical needs, their mental needs, their social needs, their emotional needs, and cognitive needs. In fact, for us to be able to provide better quality of care for them, we have to be able to meet their needs in all these aspects. Because if somebody comes in with an ailment, maybe the headache, well, we might be able to give treatment to improve the headache, but probably the root cause of the headache might be the mental aspect or social aspect or emotional aspect, something happening in the background that we don't see. It might be family relation, marital issues, monetary issues that is causing them such pain and is being manifested as headache. So for us to be able to provide quality care for service users, we need to take the holistic approach whereby we will look at all the physical needs, their mental needs, their social needs, their emotional needs, and cognitive needs. Now, once we are able to do that, then we'll be able to provide quality of care. Let's look at our next slide. With the service user needs continue. We also need to provide individuals with tools for self-determination. Individuals with tools for self-determination. We need to enable service user ownership of their own care journey. There's a need for integrating service user feedback and experience into quality improvement and keeping service user at the heart of any quality improvement initiative. Now, in the health and social care sector, unlike the manufacturing sector or the service sector, any care plan that we design for service users, we should involve them so that they will take control over their care journey, how best they should be treated. They should be actively involved. Now, if we do that, then we are actually improving quality. It will mean that any pathway of treatment that is taken, we took that decision with the service users' involvement. Therefore, they will see it as their own treatment pathway. In that case, we will be able to succeed in whatever treatment pathway that was deemed suitable for the patient because they are involved. And he said that we need to make sure that whatever they say is incorporated into the service that we provide them. So feedback and their experience of the service they receive, once they are all incorporated into the service delivery, we improve quality by not committing some of the lapses that actually occurred. So both positive and negative feedback are incorporated into the service delivery, so that lessons will be learned, so that where we need to improve, we can improve. And that is some of the ways that we can be used to improve service quality for patients. And lastly, keeping service user at the heart of any quality improvement initiative. We are not improving the quality of service for anybody. We are improving it for service users. Therefore, service users should be at the center of any decision that we take to improve quality of care. Let's look at our next slide. Impact on service users of improving quality. If we are able to improve quality of care that we provide in the health and social care environment, what will be the effect? What will be the impact on patients? Number one, it will enhance self-esteem. Service users will have that self-esteem, will be confident in the services that they have received. At the same time, it will enrich customer satisfaction and trust level. If we are able to give the best quality of care to patients, they will have confidence in the system, as they will have satisfaction in the services that we have given them. And that will mean that they have received improved quality of healthcare. At the same time, it will give them better experience of the service. And that will lead to enhancement of safety, because they will trust and have confidence that the services that is being rendered by the professionals is rendered in a safe environment. That will go on to enhance clinical effectiveness. So clinicians will also be learning day in and day out, and that will improve their effectiveness. At the same time, good quality of care being received by service users will bring a sort of good relationship between families and caregivers of the patients, because families and caregivers will be able to know and appreciate how best or what kind of quality their relatives or their patients have actually received. So quality improvement has got a lot to do with how service users will feel. Unlike the manufacturing sector, where there is a quality in terms of innovation and luxury of a car people will sit in and enjoy, in the same way, customers receiving good quality of care at the hospital will have a positive impact on their self-esteem. It will enrich their customer satisfaction, because they are the customers and they will trust the system of healthcare. And that will end up improving the quality of healthcare, improve the services, enhance the safety, enhance the clinical effectiveness, at the same time enhance relationship with families and caregivers. So let's look at the next slide. What about meeting staff needs? We've looked at one aspect of the stakeholders, being the service users, who are the core for the quality improvement. Now let's look at the other side of the stakeholders, being the staff. See, a motivated staff actually gives out their best. So quality improvement cannot be done in isolation, leaving the staff out of it. We need to be able to meet the needs of the staff. So developing and supporting staff through provision of appropriate training, appraisal, and performance management. If we want to make sure that we provide the best quality of care, then the providers, if you look at the receivers who are the customers or service users, the provider being the staff, we need to make sure that we give them appropriate training. They undergo constant appraisals in terms of their skills and competencies, and we need to manage their performance. Staff that are often sent on training, updating their skill, conducting staff appraisals, sending them on the courses and the rest, we will be able to improve the performance. That is the only way that staff can be improved. So meeting the needs of the staff is quite important if we are to improve quality of services that is provided in health and social care. Apart from training and development, we need to actively promote equality and diversity and inclusion so that every single staff there will feel a sense of belonging. And in that way, they will be able to put in their best. We cannot promote quality when there is discrimination, where people don't have equal opportunity. So one of the ways of meeting staff needs is to actively promote equality and diversity and inclusion. Again, if we need to meet staff needs, we need appropriate delegation of responsibilities. We need to delegate jobs to people who are competent. When we are not able to do all things ourselves, we need to delegate. And that is the ways or means of meeting staff needs. And then we need to safeguard staff, safeguarding staff, so that staff will feel that they are secure. That's some of the ways that can be used to meet the needs of staff members. Right. All right. What about the impact on staff and management of improving the quality? We looked at service users, impact that it will have on them when we improve quality. In the same way, let's look at the impact on the staff and management of improving quality. If you're able to improve quality, what will be the impact on the staff? Enabling effective working partnership with other professionals, that partnership working and collaborative approaches. If we improve quality, it will lead to partnership working and collaborative approaches. That will be some of the impact that it will have on staff and management if we're able to improve quality. It will also increase job satisfaction. When you are able to give the best services that you can to service users, when you are able to give out your best for patients, you enjoy some sense of pride and satisfaction in what you are doing as a person. And that will also lead to lowering of stress level. If you're a clinician or a nurse, and you've been able to provide the best job, to be able to do the best for your patient, you see the smile on the face of your patient, they receive the treatment they need, and there is a good patient outcome. You are happy. You are always happy when you are going to job because you know you are going to do the best to support people who actually appreciate what you are doing. And that in turn will give you the satisfaction, which will lower the stress level of all staff. And that will also lead to improving professionalism in the service and promoting positive working environment. People will be very, very happy and they will give out all their best. So some of the impact on staff and management of improving quality. Now, let's look at the other end of the equation. What will be the impact of poor service quality for organization as a whole and the stakeholders, be it staff be it service users, be it their families and caregivers, and the hospital or the organization, the health social care organization itself. What will be the impact of poor service quality? Number one, all the gains that we mentioned about the satisfaction that the customers will receive and how staff will be motivated and give out their best, all the gains will be negated with poor quality of service to both stakeholders and staff. For the service users, there will be poor patient outcome, including death. You are not dealing with manufacturing of cars, where defective cars can be taken out of the line and recycled. We are dealing with the lives of human beings. So the impact of poor quality service will be poor patient outcome. And in extreme cases, patient may die. What about the organization when there is poor quality? Organizational reputation will suffer. There are so many hospital foundation trusts whom, as a result of provision of poor quality service, either the organization has been fined, either it has been closed. I mean, for example, there are recent incidents of a lot of care homes in the UK being closed by CQC, the Care Quality Commission. Why did they close them? They closed them because there is poor quality of services that were given to the service users, the vulnerable old people in the homes. So the organizational reputation will suffer. And this could go into thousands or sometimes millions of pounds loss, financial loss. And when it is so severe, the Care Quality Commission, for instance, which is the regulatory body overseeing the health and social care organizations, will decide that enough is enough. In the interest of service users, we have to close the facility. There are instances where some maternity units in some hospitals have been closed, and the service users are allowed to go into the nearby hospitals. There are so many instances where service users in the care homes are moved and distributed among nearby care homes to enable them to close the facility because of poor quality service. So the impact of poor quality service on organization at the same time on stakeholders can be very dire if care is not taken. So you can see that quality is very important. It's even more important in the health and social care compared with the manufacturing sector, because if there are any defective machines or cars or computers, they can be recycled or maintained. But if you give poor quality service to a patient, the outcome and the experience will remain in the minds of the service user for life. And the worst scenario is where that poor service delivery could lead to loss of life, financial losses to the organization, as well as the closure of the organization by bodies regulating them. Let's look at the next slide. Right. We need to identify stakeholder groups and their expectation for service delivery, which we have done. We have assessed the impact of poor quality for organization and the stakeholders, and we now know how the stakeholder needs are met. So in this recording, we've been able to look at assessment criteria 1.1, 1.2, and 1.3. We now understand who the stakeholder groups are. And we spoke about service users who are patients or residents. If it's in the care home, they are residents. If it's in the hospital, they are patients that have gone there. If it's the hospice, it's still the patient. If it's still GP surgery, it's still the patient. And then we've got other stakeholders, such as families and friends. They're also interested in quality of care. We've also got caregivers who are also stakeholders. And then we've got staff of the organization who are also stakeholders. Right. And all these stakeholder groups have different expectations. The patient who has gone to the hospital expect that he's going to get well and live. That is the expectation. And they don't expect anything substandard. They want to have good patient experience and good patient outcome. That is why often patients prefer to go to hospitals where they think their expectations could be met. Even within hospitals, people would like to go to consultants who are more experienced to be able to deal with their issue. So quality is very, very important for all stakeholders. And if you take them out, the service users are out, and you come to staff, I mean, quality is so important because you provide a better quality service, and you yourself, you are happy that you've made someone happy. You put a smile on somebody's face through your expertise and the quality improvement, that quality sort of job that you have done. A patient is going home happily. Right. So we've been able to look at the needs of every stakeholder. And then we have been also been able to look at the impact of poor service delivery for the stakeholders, be it service users, the staff, or the organization. There are so many instances where poor service delivery by staff or clinicians has led to professional organizations striking some of them off the list. So the impact of poor service delivery, poor quality, could be dire to all the stakeholders as well as to the organization. There are a couple of recommended reading that you can read around and see how best you'll be able to start going around the assignment brief and looking at assessment criteria 1.1, 1.2, 1.3. Mullin 2002 is Delivering Excellence in Health and Social Care. You can have some information from there. And then we have Fallon et al. 2012, which is quite current, Managing Health Organization for Quality and Performance. You can get some materials from there. And then Ramson et al., the Health Care Quality Books. We can also have quite useful information from there. Right. We will end here and continue next Monday. But I hope you've been able to understand what we've discussed today, and you can straight away go on to start assignment, which is the assignment brief, which is loaded on Moodle. And I'm also going to load this presentation on Moodle, so you can access it and then play it and see how best you'll be able to understand what I was saying and how that matches with the assignment that has been given in the assignment brief. All right. Thank you very much. Thank you and goodbye.